And today we'll be discussing a bone, that is the femur bone, which is located in the lower limb. So we will discuss each and every aspects of its external features, including the bony prominences, the muscle attachment points, and everything will be covered in a short while. So let's begin the session, and we begin with the femur bone. So as you can see here, the femur bone, which is a long bone, is also composed of three components, namely the upper end, shaft, and the lower end. And when you consider the upper end, there are some bony prominences which is clearly visible here from this picture itself. And the shaft is quite the connection between the upper end and the lower end, and even the lower end is also slightly expanded to have two different areas. So let's discuss each and every parts. To begin with, the first one, the upper end. The most easiest identifiable part of the upper end is nothing but this rounded spherical component, that is the head of the femur. So it is almost 2/3 of a sphere, and you can see it clearly here. This is the head of the femur, and at the tip of the head of the femur you can see a small depression. That depression is nothing but the fovea capitis. The fovea capitis is a depression which gives attachment for round ligament of the femur, which is also known as the ligamentum teres, which connects the head of the femur to that of the transverse acetabular ligament. And connecting the head to that of the shaft, you can see this is the neck of the femur. Connecting between the head of the femur and the shaft, we have the neck, which is almost andro-posteriorly flattened. It is flattened in the anterior part and in the posterior part, having two borders, the upper border or the superior border, the lower border or the inferior border, having two surfaces, the anterior surface and the posterior surface. So the neck is the constricted part of the femur which connects the head to that of the shaft. And when this neck is getting connected to the shaft, it is actually creating an angle here. This is called as the neck shaft angle, which is approximately 127 degrees. That actually creates a slight tilt in the normal anatomical positioning of this particular bone. It is not standing straight, instead it will be tilted slightly in this manner. Then looking at the other external features on the upper end, you can see a bony prominence here. The bigger bony prominence, that is called as the greater trochanter, and on the posterior aspect you can see a rounded bony prominence here, that is called as the lesser trochanter. So we have the greater trochanter and the lesser trochanter here, just like that of the humerus. Humerus had greater tubercle and lesser tubercle, but here in case of femur, it is greater trochanter and the lesser trochanter. Connecting between the greater trochanter and the lesser trochanter, there is an anterior line or a ridge, a slight elevation you can see, that is the intertrochanteric line. That means which connects between the greater trochanter and the lesser trochanter. The line that connects is called as intertrochanteric line. And right opposite to it, on the posterior part, you can see there is also another connection here. The lesser trochanter is connected to the greater trochanter through a crest, an elevation. That elevation is called as the intertrochanteric crest. Different from that of the line, this is intertrochanteric crest with a middle elevation here, or a rounded bony prominence in the middle of the crest, which is called as the quadrate tubercle. So these are the major points that you have to look at on the upper end of the femur. Now coming back to the other features below the lesser trochanter, which is easy to identify. So when you look at the bone here, you can see the intertrochanteric line starting from the anterior aspect. It runs in spiral and it reaches till here. So this spiraling line, which is the continuation of intertrochanteric line, is called as the spiral line of the femur. And opposite to it, here you can see the reflection, and this bony ridge over here is called as the gluteal tuberosity. So I repeat, on the upper end we have the head of the femur, the neck of the femur, which is having a superior border, inferior border, anterior surface and posterior surface. Then we have the greater trochanter, the lesser trochanter. Connecting between them we have the intertrochanteric line, and posteriorly connecting between them is the intertrochanteric crest with a central projection that is called as the quadrate tubercle. And then we have two lines here. One is the continuation of intertrochanteric line spiraling around the shaft, that is the spiral line, and opposite to that there is a bony ridge that is called as the gluteal tuberosity. Now let's analyze each of these parts in detail. Starting with the head of the femur, we remember that the first one I told you about, the fovea capitis, which is the insertion point of the round ligament. And other side you have the greater trochanter, which is having three surfaces. There is anterior surface, a lateral surface, and a medial surface which is coming inside. So this is the anterior surface, the lateral surface, and inside you can see there is a depression. That depressed area is called as the medial surface of greater trochanter. And after that, when we consider the trochanter, like greater trochanter, on the medial aspect you will get to find a small depression which is placed on the medial surface. That depression is called as the trochanteric fossa. So we have the trochanteric fossa on the medial surface of the greater trochanter. So that concludes the upper end of femur. Then we have the shaft of the femur, which extends between the upper end and lower end. And as you can see, it is elongated, and when I hold it in the side, you can clearly see that it is convex forwards. So this is the anatomical position of the bone. The one which I am holding in my hand is actually a left femur, and the shaft is convex forwards. You can see it from the lateral view. You can see the convexity of the shaft. And when you consider the shaft of the femur, it can be divided into an upper 1/3, middle 1/3, and lower 1/3. Considering the first one, the upper 1/3, as we told earlier, it will be having a medial border, a lateral border, and we learned about two lines here, the spiral line, which is the continuation of intertrochanteric line, and we have seen the gluteal tuberosity here. So along with gluteal tuberosity, spiral line, the medial border and the lateral border, the upper 1/3 of the shaft is having four borders and four surfaces between them. The four surfaces being anterior, medial, lateral, and between the spiral line and gluteal tuberosity, the posterior surface. So that concludes the upper 1/3. Now we have the middle 1/3 of the shaft, which is having clearly three borders: the medial border, the lateral border, and on the posterior aspect we have the posterior border, which is also known as the linea aspera. So the linea aspera is a thick band or ridge-like prominence which is formed by the convergence of the particular spiral line here and the gluteal tuberosity continuation, and you can see they are converged to form a clear demarcating border, posterior border, which is known as the linea aspera, which is having a medial lip, a lateral lip, and an intermediate area. So that concludes the middle part, having three borders: the medial border, the lateral border, and the posterior border, which is also known as linea aspera. And if we consider the lower 1/3, the lower 1/3 on the posterior aspect, you can see there is a line, you can see the reflection clearly, and you can see a line here. This is called as the lateral supracondylar line, and now you can see the another reflection here. So if you observe the reflection clearly, you can see another ridge. This is the medial supracondylar line. So these two lines, along with the medial border and the lateral border, we have 4 borders on the lower 1/3, that is medial, lateral, then posteriorly we have the lateral supracondylar line and the medial supracondylar line confining 4 surfaces, namely anterior, medial, lateral and posterior surface. So this triangular posterior surface on the lower 1/3 of the shaft is also known as the popliteal surface. So that concludes the shaft of the femur. And then we have the lower end of the femur, which is expanded to form 2 condyles on either sides. So the one that is coming over the side of the head of femur, that is the medial condyle, and this expansion on the other side is the lateral condyle. So we have 2 condyles on the lower end, which can be divided into 2 components, the articular surface and non-articular surfaces. So here you can see a smooth convex surface on the inferior part. This is actually the condylar surface or articular surface of the femur bone, and it can be divided into 2 components. When I am holding the bone as such, you can see an anterior part for it, a smooth anterior part, that is the patellar surface where the patella will be articulating, and inferiorly you have 2 surfaces on the medial condyle and the lateral condyle respectively. These are the condylar surfaces, and on either side of that we have 2 non-articular surfaces, one coming on the medial aspect, this bony prominence here, that is the medial epicondyle, while on the other side the bony prominence is called as the lateral epicondyle. And above the medial epicondyle you will get to find a small bony prominence which is clearly visible here. This bony prominence is known as the adductor tubercle. So on the medial side, above the medial epicondyle, you will get to find a bony prominence which is called as the adductor tubercle. And if you turn the bone towards the posterior aspect, you can see between the condyles there is a potential space which is named as the intercondylar fossa or intercondylar notch. And on the upper part of it, you can see it is connected with a line like a ridge which is called as the intercondylar line. So these are the basic external features of the femur bone. I repeat, in short, the upper end, shaft and lower end. In the upper end we have the head, neck, the greater trochanter and the lesser trochanter. And in the shaft we had 3 areas, the upper 1/3, middle 1/3 and lower 1/3. The upper 1/3 with 4 borders, the medial, lateral, spiral line and the gluteal tuberosity. In the middle we had medial border, lateral border and the posterior border, which is also known as linea aspera, making 3 surfaces, anterior surface, medial lateral surface and medial surface here. Then we have the lower 1/3, which is again having 4 borders, the medial border, lateral border. Then posteriorly we have the lateral supracondylar line and the medial supracondylar line with 4 surfaces, anterior, medial, lateral and posterior surface, which is also known as the popliteal surface. And the lower end expanded to form 2 condyles, the medial condyle and the lateral condyle, the medial epicondyle and the lateral epicondyle. And above the medial epicondyle we had the tubercle called as the adductor tubercle, and posteriorly between the 2 condyles we have the intercondylar fossa and the articular surface having an anterior smooth part, that is the patellar surface, and inferiorly we have the 2 condylar surfaces. So this concludes the session on the osteology of femur. So these are the major external features that you should be knowing when you are studying about the femur bone. Thank you.